In this lecture, we will be talking about behavioral assessment. There are many different types of behavioral assessment, and we will briefly touch on each of these. To begin, however, let's talk a little bit about what behavior is. When talking about behavior, it's important to understand the full context in which the behavior occurs. When looking at specific behaviors, we must also assess the preceding events that led up to that behavior, as well as the resulting consequences, either positive or negative, that stemmed from the occurrence of that behavior. In observing behaviors, we should keep in mind that the behavior we observe is in fact a sample indicative of how that person is overall. Behavioralists do not look at behavior as a sign of internal processes. In other theories, you may see that behavior is the result or the outward expression of some internal conflict or cognitive viewpoint. It's the resulting action. However, in pure behavioral terms, the behavior itself is the important aspect to understand. It is not motivated by any underlying cognitive or emotional functions. And so in a behavioral assessment, our goal is not only to assess and identify behaviors that are occurring, but to design treatment plans and treatment approaches that will allow clients to change their behaviors. We've talked about samples and signs. So in a behavioral assessment, the information you collect, whether it's data on a test, information from an interview or an observation, rating scale or checklist information, all of those pieces of data are seen as samples of behavior. And our belief is that those samples can then be generalized to other situations. This contrasts with traditional views of assessment, which look at scores, responses, and observations as signs of internal processes. So our focus here is looking at the behavior in and of itself and treating the behavior, not treating any underlying cause of the behavior. Within a behavioral assessment, there are several components we look at. We're measuring the behavior itself. This includes both overt and covert behaviors. What the client is doing, what they may not be doing, behaviors that are conscious and behaviors that are subconscious in origin as well. We look at the antecedents, both internal and external. What was going on before the behavior? What may have caused the client to exhibit this behavior? We look at the consequences, the positive and negative results of a behavior. Behavioralists believe that every behavior has a meaning. There's a reason why we exhibit every behavior we do. There is some consequence we get from it that makes it worthwhile to exhibit the behavior. And lastly, we want to look at the contextual conditions in which the behavior is observed. What is going on when the behavior occurs? In what type of settings is this behavior likely to occur? It could be specific to an individual setting, or it could occur across a variety of settings. It's important to note that when conducting a behavioral assessment, the behaviors that we observe can manifest in many different modes. Behaviors can look different amongst different clients or within the same client, but in different settings. For example, an outburst of anger may look different from a 5-year-old and a 15-year-old. Defiant behavior may look different in a child at school than it does at home. So we realize there are many different modes, and these modes, or outward expressions, can have cognitive, emotional, or behavioral attachments to them. Because there are many different modes, we need to keep in mind that different behavioral assessment techniques should be considered. There are some situations that warrant a particular type of behavioral assessment. In other situations, that same assessment technique may produce spurious results, and an alternative approach should be used instead. Because individuals and settings may produce different results, it's important to have a basic working knowledge of several different behavioral techniques so that you can employ the best possible approach given the situation you find yourself in. Underlying behavioral assessment, a theoretical underpinning, would be social cognitive theory. And social cognitive theory is based on the work of Albert Bandura. Bandura believed that classical behaviorism had shortcomings. It really didn't take into account cognitive processes that may shape behavior. In other words, early behaviorists saw behavior as very organic, primalistic, and individuals could be shaped robotically with no thought given to their cognitive processes that may mediate behaviors they exhibit. For example, a classical behaviorist would posit that an individual who had not eaten in 3 days, should that person come across in a park an individual eating a sandwich on a park bench, placing that sandwich on the bench to retrieve a cell phone from a bag, that individual who is starving would run up and take the sandwich. The behavior is purely motivated by primalistic needs, hunger. Whereas under social cognitive theory, there's a belief that some cognitive process takes place. That individual may not run and take the sandwich for fear that they would be arrested or apprehended in some way. So the social cognitive theory approach pulls from many different angles in previous theoretical trains of thought. It believes strongly in the reward and punishment system that we see in behaviorism. Behavior can be shaped by the presence or removal of rewards and punishments. Behavior also can be shaped through observation of others. We learn how to act and how to respond in situations by observing others. So role modeling plays a key component. And the cognitive processes, which I've been talking about, play a role. We as human beings have control over our behavioral actions. We are not primalistic like animals. We have thought. So with that theoretical background, let's take a look at some of the assumptions of behavioral assessment. The first is that people can learn by watching others behave. One of the most impactful ways that we learn behaviors is by watching others, seeing how they do it, demonstrating correct form and technique. A second assumption is that learning is an internal process, and it's not tied directly to changed behavior. We may learn how to do something, but that doesn't necessarily mean our behavior is going to change. We can learn to ride a bicycle, but that does not mean we're going to sell our car and now just ride our bicycle everywhere we need to go. In high school, many people learn a foreign language, but it doesn't necessarily change their behavior to the point that they're speaking bilingually at home. A third assumption is that behavior is directed towards particular goals. This is borrowed from the classical behaviorism, which posits that all behaviors have a purpose. Assumption 4 is that behaviors, all of them eventually become self-regulated. We can begin to control how the behavior is exhibited and when it is exhibited. As a small child, you go through potty training, and through the process of potty training, you learn to self-regulate your behavior. Instead of relieving yourself in your diaper all of the time, you now are able to self-regulate and wait until there are proper facilities available for you to use. A fifth assumption is that reinforcement and punishment can have both direct and indirect effects. Not only does the presentation of a reinforcement or punishment influence your behavior, but the mere idea that it exists out there motivates your behavior. People continue to play lottery, reinforced by the belief that they will win millions and millions of dollars, even though the odds are very slim. Following along with Bandura's social cognitive approach, our behaviors then form a combination. Our behaviors are neither completely driven by our inner forces, so we do not have complete control over all that we do, nor are they controlled exclusively by external stimuli. Instead, we look at a model called triadic reciprocality, and the model states that behaviors, cognitions, and other external events all operate on one another and influence one another. Usually, it looks something like this. There is a reciprocal relationship between an individual, their behaviors, and their environment, where each is able to interact and affect the other. The environment changes an individual and changes the way they behave. The individual who hasn't eaten in 3 days becomes a changed individual. And so their behavior changes. They may now steal food where previously this was not in their character. That changed behavior changes their environment. Now perhaps they're wanted by the police and they're on the run. That new changed environment continually again changes the person. Now they become more distrustful of other people, afraid that they're going to be turned in or apprehended. And so their behavior changes and they become more secretive and elusive. And the cycle keeps going again and again and again. So in treating behaviors, we need to work at these other areas as well. Just changing the behavior does nothing to change the person or the environment. We need to somehow stop the cycle at all different levels. To understand and identify behaviors, there are several different types of behavioral assessments that you can use. You may use interviews, observations, or rating scales. There is a proper time and place for each of these in the clinical setting. And we'll talk about some of the more common ways that these are applied. In terms of behavioral interviews, interviews allow counselors to ask questions that are focused on target behaviors. So we have an idea, whether it's from a client self-report or a report from another person, a doctor, physician, teacher, counselor, spouse, about what behaviors we may need to be looking for. With that starting point in mind, the counselor can begin interviewing to find out more about that behavior. The goal here is to gain perspective on the problem behavior. What's going on? Why is this behavior occurring? How long has it been occurring? What are some of the antecedents or preceding events that lead up to this behavior? And what are some of the results or consequences? Identifying what some of the antecedents are will be helpful in structuring a new environment that does not have or include the stimuli that led to that behavior. These interviews can be informal and constructed completely by the counselor based on the client and situation, or they could be more formal. There are new structured diagnostic interviews that can be used. The advantage of these is that you are gathering all the information needed to make a pertinent or relevant diagnosis. The drawback, of course, is that it's not individualized to the client. Rating scales also can be used. Rating scales provide a standardized way of gathering information about behavior. A rating scale is typically used when you're trying to gather information about symptoms. What is it exactly that the client is demonstrating? To increase the context in which these symptoms are noted, parents as well as teachers can complete rating scales, and the scores of the two can be compared and contrasted. A benefit of a rating scale is that it allows for degree and intensity to be observed. Likert scaling responses are used. So not only is the behavior noted, but the respondent gets to indicate the severity or intensity of that behavior. Does it happen every once in a while, multiple times a week, or every single day? Rating scales are algebraic in nature. Using statistical analyses such as factor analysis, different scales can be created on these rating scales. Certain items factored together to produce subscale scores that are indicative of a specific type of behavior. Similar to, but still different from rating scales, are checklists. A checklist simply provides a frequency count in terms of how often a behavior occurs. Respondents are typically giving a list of behaviors to observe for. And a number is given as to how many times that behavior occurs. Typically, it's in a given rating period. It could be a day, a week, a class period. The checklist is additive in nature. The number of times events occur are simply added up to give us a snapshot of what the predominant behaviors are that that child or adolescent is exhibiting. When using rating scales, we need to remember that it's important to supplement the information gathered on these scales with directly observed data. Observing for ourselves allows us to see if what others are reporting is accurate or if it's been embellished or exaggerated in any manner. We also should consider that the data should be corroborated with other observers. If a teacher rates a student as having poor behavior in class, we should look to see if others at the school, whether they be teachers or administrators, share that concern. Or is this teacher alone in their belief about the child? And the rating scale that you choose should reflect your overall goal of the assessment process. What you're measuring should relate to what it is you're trying to do in counseling. We need to be careful to not take information and skew it towards the negative. Since many times in behavioral assessment, we're looking to observe for problematic behavior or behavior we're looking to change, there could be a tendency to skew towards the negative. Whereas even mild behaviors may be marked as being disruptive simply because of the practice of this is what we're doing, observing for problem behaviors. And finally, we should collect data on the informant and their perceptions. If we collect data from a parent or a teacher, we should understand what the perceptions are that that parent or teacher holds towards the child. If in general they hold a negative viewpoint, then we may expect that their scores on the rating scale will reflect that and be more negative in nature. If the parent is more forgiving and places the child on a pedestal, we may not see any behaviors noted. Taking these considerations in mind, rating scales still make for a great tool to use in the assessments. They can be conducted quickly and without much training. They can provide us with data on low frequency but important behaviors. And they provide us with objective ways of looking at behavior. Rather than a subjective approach where a teacher may say that this child is just problematic or a troublemaker, now we can see specifically what they're doing and how frequently they're doing it. They also allow for information to be gathered where the client may not be as participatory as we would like. When clients are less forthcoming and not willing to share information, rating scales allow others who still have perspective from which to speak weigh in on what they see or observe in the client by way of behavior. They allow us to assess for longitudinal growth. As children age and develop and mature, how are their behaviors and the frequency and intensity of those behaviors changing? And as we discussed earlier, we're looking at gathering information from people who know the child best, who may be around the child the most, and be in an excellent position to share what they're observing. There also are some disadvantages. There can be some problems in the responses that we get. There could be halo effect issues, whereby the child alters their behavior because they know they're being observed. There may be issues with leniency or severity. As we've talked about, perceptions of that identified client that we're observing may shift what we see. If we have a negative perception of an individual, we might scrutinize their behavior more and look for negative behaviors. If we really like an individual, we tend to be more lenient and allow some problems to go by, giving that person the benefit of the doubt. And central tendency effects. We know from central tendency and standardization that over enough replications of a study, scores begin to gravitate towards the mean. There's a regression to the mean, so behavior is likely to change as well. In terms of error variance, we also need to consider sources of error related to the assessment itself. What instrument are we using? What type of setting is it? Is it at home? Is it at school? What time is it? Are we doing it on Friday afternoon? Are we doing it right after lunch? Is it in the late spring, early summer before school is about to get out? And lastly, what are the psychometric properties of the instruments that we use? Are they psychometrically sound? Are they reliable? Are they valid? There are types of rating scales you could use. Some of the more common are listed here. And so we'll briefly go through these just to familiarize you with what they are. The behavior rating profile uses an ecological approach. It explores behaviors across many environments, the home and at school. It also gathers information from students themselves, parents, and teachers. So there are 6 forms: a student, parent, and teacher school form, and a student, parent, and teacher home form. The instrument is designed to identify deviant behavior. From that identification, we can begin planning academic or behavioral programs. A second instrument is the Child Behavior Checklist System. This instrument is part of the Achenbach Behavioral Assessment System. It's used by parents and teachers to provide descriptive data on competencies and problem behaviors. A series of questions are asked, and respondents are asked to rate the student as either not true, somewhat true, or often true in terms of their exhibiting that behavior. So a question may ask, gets out of chair and disrupts others, and so it's rated. That's not true of this student, that's somewhat true, or that's often true. Responses to questions are then grouped together to form syndromes. And these syndromes identify problem behaviors that may need to be addressed by the counselor. Another you may see is the Connors rating scales. The revised version, which recently went out of press and was replaced by the new third version, is used to diagnose and evaluate problem behaviors. It assesses problems that are cognitive, behavioral, or emotional in nature. There are 3 forms that are used, one for the parent, one for the teacher, and one for the self. A series of signs and symptoms are included in the questions, and these respondents state how frequently that behavior is exhibited by the client. And it's used primarily to diagnose for ADHD. The last one you may see is the Walker-McConnell scale. It's used to identify social skill deficits. Teachers and administrators can complete this form. It has 43 different items that talk about social skills that are desirable in students. Respondents then rate how well an identified child has those skills. And because social skills are developmental, separate forms exist for children and adolescents to represent what would be appropriate skills or behaviors for that age group. In addition to using these instruments, you may also choose to develop your own rating scale. In doing so, there are some considerations you should pay attention for. For one, you need to properly define the theoretical construct you wish to assess. If you're assessing problem behavior, you need to have an objective definition of what problem behavior is. You then need to determine how you're going to measure that construct. So how will you measure problem behavior? Once you lay the groundwork, you can now begin assembling items to appear on a scale. Initially, you want a larger pool of items because some may ultimately not make it onto your survey. You're going to attempt to validate the items. You may seek out a panel of experts either researchers or practitioners in the field who could look at your items and give you some guidance as to whether or not they should be included, they're relevant to that construct. Taking the best rated items, you then pilot test your rating scale and collect information from a sample group of individuals. Those scores could then be entered into a factor analysis that allows us to see how accurate the scale is. Is it reliable and valid? Through that factor analysis, you most likely will find items that do not contribute to the overall score. And so these items would be deleted, and only the most pertinent items are kept. That revised instrument is then re-administered to a new group of sample subjects. And it's on that group that you compute your reliability and validity. And these are the values that would be reported in the test manual or any review of the test that's published. A third type of behavioral assessment is behavioral observation. Observations provide us with a method for objectively measuring behaviors. Using observational data provides us with greater external or ecological validity than rating scales. We're actually seeing it happen rather than taking someone else's word that it happens and happens the way they say it does. Observations also go a step further in that now we also have information on frequency and function. How often is the behavior occurring? And what is the benefit of that behavior for the client? What did they get out of that behavior being exhibited? Despite these benefits, some of the drawbacks are that observations are costly. They take time, money, and resources. Whereas a rating scale can be filled out in 5 to 10 minutes, with an observation, you now need to sit in a setting and observe a client for an hour, 2 hours, to gather the same information. Your observations may not generalize to all instances or settings. You may observe a child in a chemistry class, and it may be that they hate chemistry, and so they act accordingly. Or they're very proficient in chemistry, and the pace of the class bores them, as they're at a level more advanced than their classmates. These same behaviors may not be exhibited in a math class or an English class. So the context needs to be considered. And finally, we need to be aware that our presence as an observer may have a potential bias on the responses we see. Clients may act out knowing that they're being watched, or they may curb their behavior, tone down what they normally would do to present themselves in a more favorable light. So the sample of behaviors we get may not really be indicative of how this individual acts the majority of the time. There are different types of observations. There are naturalistic, analog, and self-monitoring. In a naturalistic observation, we are going to observe and record behaviors as they occur in the natural setting. So if I wanted to observe how a child interacts with peers during a recess or play periods, I would go to the school and follow the child out into the playground during recess and play periods and see what's going on. When conducting naturalistic observations, we need trained and objective observers. They need to be trained in what they're looking for and how it should be coded. If, in this example of children on the playground, we're looking for aggressive behavior, all observers should be trained into knowing how to spot aggressive behavior. Is it physical aggression, pushing and shoving, or could it be verbal aggression as well? As the observer, you should have minimal influence on what is going on. As best as possible, you should blend into the background so as not to bias what's going on. Analog observations provide indirect measures of client behavior. With an analog measure, we are using a simulated environment. This simulated environment replicates the client's natural surroundings. So examples are if you bring clients into the counseling room and you ask them to talk about their differences or why there is problems between them. Why were they fighting on the playground? Well, now it's a simulated environment. It's not in the natural setting where the behavior occurs. While it gives you more control, you sacrifice generalizability. What you observe in this simulated environment may not be how that individual performs in general. Taking an example from the sports world, you may have an individual who excels at batting practice before the game, or is a great free throw shooter in practice. This is a third type is self-monitoring. Here we ask clients to observe and record their own behavior. Benefits of self-monitoring are that now we could look at subtle changes and underlying thought process. Since the client is the one doing the recording, they could add in their own interpretation of why it was that this happened. I started to feel nervous knowing that the game was on the line, and my concentration swayed. That's why I missed the shot. It also allows us to gather information over a greater time period. As counselors, we can't be with our clients every minute of the day, but through monitoring, we're able to gather information from those times when we're not there. The drawback to this approach, of course, is that reliability and validity issues come into play. How accurate and reliable are the results we get from client self-report? So let's say we have a client who is trying to lose weight and is on a diet, and we ask them to make a note of every time they eat something they shouldn't eat that's not on their diet over the course of a week. And so one night at midnight, the client gets a craving for chocolate chip cookies and goes and has some cookies. They may feel bad about it afterwards and say, I'm just not going to put that on the list. I'll pretend that didn't happen and I'll start again tomorrow. So some observations may be missed or not included in self-monitoring. When observing, it's important to pay attention to how we are recording information, what type of coding procedure we use, and there are several that can apply. Event recording is a way for us to observe clearly defined behaviors. Raters are given a list of behaviors that they're looking for. They're typically uniform in their duration, so it's not one behavior that lasts 10 minutes and another one that is an instantaneous behavior. And they should not occur continuously. They need to be discrete, individual examples. So a behavioral rating looking at this event recording may have items that we look for in a class. Student talks to another student. Student begins drawing pictures on their notebook or on the desk. Student looks out the window. These are all examples of behaviors that may be consistent with attention deficit. Using event recording, we record our observations using an ABC model. As we see the behavior, we note what happened right before it. What was the behavior, and then what was the consequence? Did the teacher say or do anything as a result of the child losing attention or focus? An example of the ABC model event recording sheet is on the Blackboard page for you to use. Interval recording also can be used. When using interval recording, you select amount of time to observe a client. So I may choose to come observe you in the classroom for 1 hour. I then divide that time period into equal intervals. So let's say every 10 minutes. And then I record whether or not that behavior occurs in the interval. I could use either the whole interval method or the partial interview method. In the whole interval method, I'm looking at that entire 10-minute block. How many times did a behavior occur? So if I come to your classroom and I'm going to observe for how many times you ask questions. For that 10-minute interval, I will make a note of every time you ask a question. It could be 1, 3, 7, or 13. Every time you ask a question, I make a tally mark. In the partial interview method, I'm only noting whether you exhibited the behavior in that interval. So you only need to exhibit it once. After you ask the first question, I make a note that that behavior was exhibited in that 10-minute interval. It doesn't matter if that's the only question you ask or if you subsequently ask 10 more questions. Time sampling is an approach that's similar to interval recording. The difference here is that you only have a single observation. So again, I would have a 1-hour class period. I'll divide it up into 6 10-minute sessions. But instead of observing you in 10-minute blocks, what I do is I set a stopwatch, and I have the stopwatch go off every 10 minutes. As soon as it goes off, I look up and observe what's going on and make a note of what's going on at that specific time. I then reset the watch for another 10 minutes and wait. And when that 10-minute alarm goes off, I record what's going on at that time. So at the end of the hour, I will have 6 observations that I note. The drawback here is that there are unexplained gaps. What was going on in between? It could have been just random luck of the draw that my observations fell at times that were lulls when activity was not going on or behaviors were not being exhibited. In addition to observing behaviors, I also could do duration or latency recording. With duration recording, I'm observing and noting that a behavior occurred, but I'm also making a note for how long the behavior persisted. How long was the child disruptive? Did the disruption last 30 seconds or 10 minutes? I also could record the latency. How long were the time intervals between observed behaviors? Was this child having a disruptive episode every 5 minutes? Did they just have one at the beginning of class and then maybe one right at the end? So identifying how long they last and what goes on in between them also provides us with useful information in targeting a treatment plan to change behaviors. Regardless of the targeting and observation you do, there are reliability and validity issues we need to keep in mind. We have to have defined domains and constructs. We need to be objective and specific as what it is we're looking for. Our trainers need to be, or our observers need to be trained so that they can reliably note target behaviors. We should also use social comparison data. How do other classes act? How do other students perform? Are the behaviors we're noting here developmentally appropriate? Or are they different? What is the effect of observer reactivity? How are they reacting to there being an observer in the room? Is that causing a difference in behavior? Is there a situational specificity? Perhaps this behavior only occurs in a certain class or with a certain teacher. We should make sure we use appropriate recording techniques. There are times when a time sampling approach may be preferential over an event recording, or an interval recording may be the best approach in some examples. And finally, we need to be aware of any biases we may have, or expectations or influences from outside sources. There may be individuals who have a vested interest for results to come out a certain way. And that may influence us unduly to find information that supports what they want to be seen. The last approach I want to talk about in this lecture is the functional behavioral assessment. And functional behavioral assessments are becoming much more popular in school settings. The functional behavioral assessment is a problem-solving process that's used to address problem behaviors. Behaviors are identified. Any factors, both within the client and external to the client, are identified. The consequences of the behavior are discussed. And a treatment plan is put in place to address the behaviors. In 1997, the Individuals with Disabilities in Education Act, or the IDEA Act, stipulated that functional behavioral assessments and individualized education plans were mandated whenever children's behavior interfered with their learning or that of their peers. So schools are required to conduct functional behavioral assessments when behavioral issues are interfering with the learning process. A lot of times the behaviors we see, or the misbehavior we see in children, is the result of attention seeking. Individuals are looking for attention, positive or negative, and so they may act out to get peers or teachers to react to them. Behavior may be for an escape or release. A child may be uncomfortable in a classroom and act out, hoping to be sent out of the classroom or to the principal's office to escape that situation. Or it could be for goal attainment. Children may have specific goals or objectives they want to accomplish, and their behavior allows them to achieve those goals. So what goes into a functional behavioral assessment? It's based on that ABC model of observation we discussed earlier. We're looking at the antecedents, the behaviors, and the consequences. So not only what happens, but what preceded and what follows. We need to interview all potential stakeholders, not only looking at the student, but perhaps discussing with teachers and parents to see how these behaviors manifest in other settings. We then develop a working hypothesis. What do we think is the cause or root of this behavior? Based on that hypothesis, we implement an intervention plan to try to start curbing or changing that behavior. Should it not be effective, we can go back and change our hypothesis and approach the situation from a different angle. When observing a child as part of a functional behavioral assessment, it's important to compare that identified patient with another student in the class. Is their behavior markedly different from others in the class? Or are they just exhibiting behavior that's developmentally appropriate for that child? Talking without raising your hand is a challenge for many children in kindergarten, first, and second grade. It may not be a sign of disruptive behavior. It may just be developmentally appropriate for that age group. We should sample behavior every 30 seconds. Short durations are best to make sure that we're not missing any information. Your assessment report should have copious notes, other things that are going on. If observed in a school setting, what the teacher was doing, what activity was going on in class, what time of day it was, all this information. And you should compute what percentage of time the child stays on task. We talked about problem behaviors not being continuous, so there should be times when the child is doing what's expected of them. Once we compute that time, we'll have a ratio of the percentage of time that they are not on task to the percentage of time they are on task. Questions that you should seek answers to, and these could be questions that you either directly ask to shareholders or you answer yourself based on your own observations. As you can see, they're designed to identify what the problem behaviors are, how are they manifested, what's been done to curb them in the past, what may be causing or exasperating the situation, and how they could be changed going forward. Effective behavioral plans have structure. There should be an identified case manager who's responsible for the plan and its implementation, making sure that all parties involved are doing what needs to be done for the betterment of that child. There needs to be clear goals and expectations. What is it that we're working towards, and how will we know when we've been successful? There needs to be specified interventions and staff agents. Who is responsible for what? What will the teacher need to do? What will the counselor need to do? What might parents need to do? And lastly, we need to determine a review date for reassessment. When will we come back and observe again to see if what we've been doing has been successful? To see if what we've been doing has changed behavior for the positive. And so, given the rise of importance in functional behavioral assessments, I believe it a good idea to become aware of their uses and have a working knowledge of how they should be applied. There are some documents and examples of functional behavioral assessments on the Blackboard page for you to review. I encourage you to look at those and consider how they may be used as part of your counseling practice. Now, as we wrap up this lecture, let's briefly look at some ethical and legal issues related to behavior. It's important that we get informed consent. Clients should have an opportunity to know what it is they are getting involved with before they sign on to be a participant. Consent must address their knowledge, voluntariness, and competence. They know what's going on. They know that their participation is voluntary and that they can end participation at any time. And the competence of you, the recorder or observer. We also have an ethical obligation to use valid assessment procedures. Any tests, measures, or instruments we use should be validated for the specific purpose they were intended to be used. We should only use instruments that have adequate psychometric properties. Research is required to make sure that we're using up-to-date information and instruments that are current and represent the best we have to offer in the field at the time. And depending on the requirements for administering the test, make sure that we're properly trained and qualified to administer the test. And lastly, we talk about privacy and confidentiality. Who will have access to the results of these assessments? The client, as well as the parent, if it's a minor child, have access to their records. And they will be able to see what you're documenting. You should not be releasing your records without written release from the client or parent. So other teachers, school officials, who may not be directly related in the care and treatment plan, should not be accessing information in these records. And you're to maintain the privileged information stipulation unless the client specifically waives that right and gives you permission to share with other people what was discussed. We are responsible for keeping client information confidential. Clients could share their information with whomever they choose. So hopefully this lecture has helped you identify how behavioral assessment can be an integral part of your clinical assessment tool bag. It provides you with several different ways to gather firsthand information from clients or from your own observations that can be used to supplement or amend previous hypotheses or conceptualizations that you may have about a client.